Health Promotion Model and Childhood Obesity. Purpose of the model. Nola Pender's health promotion model is one of the middle-range theories of nursing that introduces knowledge to fill the gap between principles of nursing practices and their practicality by incorporating patients' lifestyles into the treatment. The model allows the nurses to seek information about the patient's lifestyle to administer a treatment that would not harm the patient after the recovery. The primary objective of the research is to develop a new piece of knowledge to fill an existing gap in the research question. Nola's model can provide insight into many health research questions because of its view of the patient as a component of spiritual, social, and physical well-being. Hence, it makes nursing a collaborative practice between various individuals in nurturing an appropriate atmosphere for the patient. Concepts of the theory. Nola Pender's health promotion model has 4 crucial components, which include a person, environment, nursing, and health. A person is a social being that seeks to create an environment that promotes a sustainable lifestyle. Secondly, the environment is crucial to the patient because the mind works correctly while in harmony with the surroundings. Thirdly, nursing, as a concept of the theory, is the care given by individuals within the patient's surroundings to achieve a quick recovery. For this reason, the approach removes the notion that medics have the entire responsibility of taking care of the patient and makes it the responsibility of everyone close to the patient. Lastly, well-being is referred to as the inner peace that a patient has when environmental factors suit the lifestyle. The theory views a patient's health as harmony between the environment and an individual's well-being. Definitions of meta-paradigm components of the theory. According to the theory, a person or client is defined as a biopsychosocial being that attains maximum potential of well-being whenever environmental factors are designed in such a way that they favor the psychological needs. In other words, a person is a social being and hence needs an environment that favors peace of mind. Secondly, the environment is defined as every component that surrounds a person or client. It refers to the cultural and heritage backgrounds of an individual, which determines the type of lifestyle and social well-being of a person. Nursing refers to a collaborative effort made by individuals, such as relatives, friends, and society, to create an atmosphere that is conducive to the well-being of a patient. According to the theory, nursing is a collaboration of individuals attending to a patient to attain a quick recovery. Lastly, health is only defined as the well-being of a client whenever the environmental factors are in harmony with psychological needs. Good health enables a person to attain maximum potential and hence has to have an environment that favors social growth needed for psychological health. Research question and rationale. Does obesity affect or limit physical activity in African American children aged between 5 and 7 years in Baltimore City Public School? Obesity is a state of health that affects physical activity and hence the well-being of a person. The rationale behind the research question seeks to find answers that can only be answered by applying the Nola Pender health promotion model. Research variables. The research proposal focuses on 2 variables. These are obesity, which is the independent variable, and physical activity, which is the dependent variable. The research seeks to determine if there is a correlation between obesity and physical activities. Based on how the research question is framed, it is clear that the research seeks to determine the effects of obesity on physical activities among children. Consequently, it will focus on how the disease limits physical activities among children. Suitability of the model to the research proposal. Looking into the practicality of the model in this research question, nurses look at obesity as a health disorder, which results from the patient's lifestyle. In the treatment procedure, other people get involved because a patient needs to change the environment that is controlled by those that are close at all times. Relatives are advised to help a patient to adapt to a new lifestyle by ensuring that the patient's well-being is not negatively affected by the process. When a patient starts recovering, physical activities that were earlier inappropriate and risky become of great benefit to that person. Also, it becomes easier to relate to other individuals within the surroundings because a person feels at peace with the environment and hence accepted. Hence, Pender's theory is appropriate for the research proposal. It helps the nurse identify the relevant type of treatment to be administered to the patient. It also helps determine the kind of lifestyle environment that is suitable for the patient during the recovery period. Conclusion. Nola Pender's health promotion model is necessary for nursing because it offers a simplified way of looking at the patient's problems, where a solution begins by looking into the lifestyle and making the patient feel appreciated. The model makes a person feel responsible for their self-treatment by acknowledging the efforts of the nurses and people that are close to the patient.